Pharmacy exam important MCQs. First one is all of the following are potential treatment options for psoriasis except options are salicylic acid, topical hydrocortisone, coal tar, ketoconazole. Answer is option D, that is ketoconazole. Ketoconazole is not an appropriate treatment option for psoriasis. Which of the following tinea infections is not appropriate for self-treatment and must be referred to a physician? Options are tinea nigra, tinea corporis, tinea cruris, tinea pedis. Answer is option A, that is tinea nigra. Only three types of tinea infections respond to self-treatment with non-prescription therapies. That is tinea corporis, tinea cruris, and tinea pedis. All other tinea infections should be referred to a physician for evaluation and treatment. Which statement concerning the use of over-the-counter analgesic agents is true? First option is aspirin is indicated for mild to moderate analgesia, inflammatory diseases, antipyresis, and prophylaxis for patients with ischemic heart disease. Next option is ibuprofen is indicated for mild to moderate analgesia, reduction of fever, and prophylaxis for patients with ischemic heart disease, but not for inflammatory disorders. Third option, acetaminophen is indicated for mild to moderate analgesia, but not for reduction of fever and osteoarthritis. Option D, naproxen sodium is indicated for mild to moderate analgesia, antipyresis, and prophylaxis of patients with ischemic heart disease. So, here the answer is option A, that is aspirin is the only analgesic agent with an approved labeling for analgesia, antipyresis, inflammation, and prophylaxis for ischemic heart disease. The US Food and Drug Administration, that is US FDA, has approved which ingredient for protection against painful sensitivity of the teeth caused by cold, heat, acids, sweets, or contact. Options are dicalcium phosphate, sodium lauryl sulfate, 5% potassium nitrate, zinc chloride, calcium carbonate. Answer is option C, that is 5% potassium nitrate. Desensitizing agents should not be abrasive or used on a chronic basis unless directed by a dentist. The products approved by the American Dental Association include the ingredients 5% potassium nitrate, 10% strontium chloride, and dibasic sodium citrate 2% in pluronic gel. A 27-year-old presents with sneezing, rhinorrhea, and nasal itching, which started 2 days ago. She feels miserable with her symptoms, which worsen when she cleans the house. Her current medications include calcium carbonate and lucosate sodium. Which of the following would be the best recommendation for immediate symptom elevation? Options are chlorpheniramine, pseudoephedrine, topical nasal strips, intranasal cromolyn. Answer is option A, that is chlorpheniramine. Rhinorrhea, sneezing, and nasal itching are symptoms of allergic rhinitis. Pseudoephedrine and topical nasal strips are indicated for nasal congestion, which she does not have. Both chlorpheniramine and intranasal cromolyn sodium are recommended treatments for the relief of sneezing and rhinorrhea. However, this patient needs immediate relief, and cromolyn sodium will take 1 to 2 weeks for noticeable symptom improvement. So, hence, here the answer is option A, that is chlorpheniramine.